Hi, my name is Dr. Paul Feuerstadt. I'm an associate clinical professor of medicine at the Yale School of Medicine and an attending gastroenterologist at the PAC Gastroenterology Center. I'm absolutely delighted to be here today. Thank you so much for having me.
For my first question for you, what might explain the strong association between improved mental HRQOL and shifts in the gut microbiome among RBL responders?
What's really cool about this study is that it takes information, the microbiota, or what's actually in the microbiota, the constituency, and it relates it to health-related quality of life. So how patients are actually feeling. So it's one thing to cure C. difficile infection, and of course, patients will feel better. But there were a couple of signals that we were seeing from the pivotal phase 3 trial where patients that recurred who received placebo had no impact or actually a negative impact on their health-related quality of life. Whereas patients who received RBL or Rebyota, they actually had an uptick in their health related quality of life, even if they recurred, which is a little bit quizzical. Why would that happen? So, in this abstract and in this study, we dug deeper. We did a Dirichlet multimodal recursive partitioning analysis, basically saying correlating health related quality of life with changes in the microbiota. And what we found was fascinating that patients felt better, regardless actually of recurrence or not recurrence, if they had changes in improvement or increases in Bacteroidia and Clostridia and decreases in Gammaproteobacteria and Bacilli. So the trend was feeling better, increases in Bacteroidia and Clostridia, decreases in Gammaproteobacteria and Bacilli.
And that kind of goes right into my second question on how do changes in the specific bacterial groups, like the two, relate to better patient-reported outcomes in this study? And maybe can you just explain to me some of the ways that they feel better, maybe how they explain how they feel versus when they don't feel better, how they explain that?
Within this study, something called the C. diff 32 questionnaire was used. And that's a questionnaire that asks patient about how they're feeling physically, mentally, and socially. Physically, that's easy. Are they having any abdominal pain? Are they having any diarrhea, etc.? Mentally, are they feeling depressed symptoms? Are they feeling more uplifted? And then socially, are they feeling comfortable going out socially, not having to laser look for a bathroom every single time they walk into a restaurant or feeling tethered to the bathroom all the time? Within this study, that C. diff 32 questionnaire, 32 questions, was correlated directly with those microbiota changes, showing that Bacteroidia and Clostridia positively associate with good outcomes, feeling better physically, mentally, and socially.
And then that kind of also goes into my last question, just how can these metrics and microbiome data eventually help guide more personalized treatment approaches for recurrent C. diff?
So I think actually, yes, this will help with recurrent C. diff and explain why patients are doing better emotionally, physically, and socially after these treatments. But also, this applies probably more broadly. And we have to do more research in that space. But this says perhaps maybe if we alter somebody's microbiota and they have depressive symptoms, if we can define what the dysbiosis is, plainly stated, what's deficient in their microbiota, perhaps we can boost that and alter their overall aura, whether or not they're going to be having a positive outlook, whether or not they're feeling well on a daily basis, and whether we can avoid depression. So perhaps depression is associated with the microbiota, and that's a metabolic effect. As you said before, the metabolome, the metabolic impact of what the microorganisms in the gut dictate can hopefully and potentially have a significant impact on people's outlook on life. I think that this is really fascinating because what we're seeing is, yes, C. difficile is a lock and key fit. Patients need treatment with standard of care antimicrobials to control one part. The spore part needs a healthy, diverse microbiota. So we know that that works. But the after effect or the side effect is this impact on health related quality of life. And the fact that we're able to clinically correlate the symptoms with changes in the microbiota in terms of health related quality of life, that's really fascinating. And I think it's opening doors and opening new avenues for research. So I'm super excited about it.